In July of 2020, we engaged General Electric Consulting Services to help us with our perioperative service line. We felt that there were some real opportunities to improve and make this a better process for our patients, our staff, and our providers. Those opportunities included our first case start times, our turnover times, our ability to make sure we have preference cards that are up to date so that we can provide the equipment, supplies, and instrumentation that are needed on time in the perioperative areas. All of this is to help with driving our quality and our safety for patients, again, our staff and surgeon satisfactions. So block scheduling has been a process here as well as at most hospitals. The policies that were developed were done within Good Samaritan. When we wanted to see what was best practices out there, and GE was able to help us with that. So we crafted with our providers being present and engaged in this process, how we could improve our block scheduling. And we made significant changes with that. I think one of the benefits that we have seen with GE coming in is that they engaged the employees and our providers from the very get-go. We couldn't make these sustained improvements without our team being very engaged in this. And just as an example, our block scheduling policies, which were changed pretty dramatically, had 100% approval from our Perioperative Governance Committee. That's rare.
Our staff are going to benefit with respect to being able to predictably go home on time, being able to predict breaks, lunches. I think that they are going to see more continuity with our rooms and are having the same surgeon in the room for the entire day, as an example, is a big satisfier and it's a big win. They're going to be able to plan their days out a little bit better. And for me, managing these teams, it is definitely going to flow a lot better, a lot more succinct and smoother. I hope that our patients are going to see an improvement from the scheduling process right to the throughput of them getting home. Our patients are going to be able to have less wait times. Ideally, they're going to be able to schedule in a shorter period of time.
It's going to make the patients wait less for their surgeries. It'll also help them be more comfortable knowing that their surgery will start on time, because having to wait for surgery is very stressful. So if you can decrease the stressors and have better communications and more efficiency, it makes the day go by better, makes things more fun to be at work, makes things better for the patient. They know they're going to get fantastic service each and every time.
In the long term, what this is going to do, again, is give us some means of tracking how good of a job that we're doing over time. It's going to give us the tools to then make adjustments based on that. But in the meantime, it's also going to give us the tools to improve those sorts of things. Improve staffing, improve anesthesia, improve efficiency, improve throughput, increase the number of patients we can take care of in a timely fashion, improve the ability to schedule cases and cut down on delays and cancellations. Ultimately, that's going to benefit our whole community and everything that we're here to serve. But in the end, it's going to benefit the hospital as well, including being able to generate and maintain an appropriate, equitable, and good income from the operating room by increasing the number of patients and decreasing the amount of waste, basically.